Hello guys, hope you're all great. And I've been uploading quite a few video images, video recordings to make you guys understand for different common ultrasonic abnormalities where you quite often get confused. So today I'm discussing about the lymphadenopathy, and I have selected images, I have selected videos to let you know that how it will appear on the ultrasound imaging. You guys are well equipped with the knowledge of the diagnosis of the lymphadenopathy, but the main reason behind is that you have to just expand your knowledge, expand your vocabulary, and you should put this into practice into your on your report to help your colleagues. Like so far the lymph node enlargement are concerned, you must pay attention while you are doing the cervical region, the anterior triangle and the posterior triangle. And then after that you have to look for the para-aortic enlarged lymph node, and then you should have to look for the inguinal lymph node. These are the three common region. Yes, axilla is also the part of it, while if it is related to the female and or if it is related to the breast abnormality, so you should have to look for all these areas for the enlarged lymph node. If you detect any enlarged lymph node and you label it as an enlarged lymph node, mind you that you know the criteria. You have to look for the anterior posterior diameter enlargement regardless of the transverse diameter. So pay attention to the anterior posterior diameter. So if it is enlarged, and after that you have confirmed that the outline is smooth and there is a preserved fatty hilum and there is no internal necrosis, these 4-5 points are criteria for labeling the enlarged lymph node. You must mention this on your report, and then after that consider whether it is inflammatory in nature, or it could be tuberculotic in nature, it could be secondary to metastasis, and on the fourth differential you may think of lymphoma if there is a patient history supported, and you may think of carcinoma as well. So these are 4-5 points. You should consider all these points by taking the history, by looking the previous medical record. So all this will help you to shape your differentials and diagnosis as well. I have selected this video. It will show you some enlarged lymph node in different areas. So just have a look and write your report and expand your vocabulary and your medical knowledge regarding the differential diagnosis and particularly diagnosis. So let's watch this video. Here in this image you can appreciate a right-sided enlarged submandibular gland indicated by the red arrowhead. This is how the patient will come to the clinic with the complaint of visible lump or palpable lump in his neck region, or maybe in the posterior cervical region. Here you can see another enlarged lymph node in the posterior cervical region, and the patients come to the clinic with a complaint of having palpable lump, and when you palpate it you can easily felt that there is a lump, and sometimes it is visible enough to appreciate directly. So this is how the enlarged lymph node will look on the clinical examination. This schematic chart has been given to familiarize you with the presentations of the lymph node and for the revision of the anatomy. Here you can see that the cervical lymph nodes are categorized or given into 7 levels. So this is called as 7 level of the cervical lymph nodes. On the top you can see level 1 and 2 is denoted as 1A and 1B. These are the submental and submandibular lymph node, which is categorized as cervical lymph node level 1 and level 2. Next comes 2A and 2B, cervical level 2A and cervical level 2B. These are actually called as parotid lymph nodes and occipital lymph nodes. So these two are denoted as 2A and 2B. Cervical level 3 and cervical level 4, these two levels are called as deep anterior cervical lymph node. So these two are level 3 and level 4 would be deep anterior cervical lymph nodes. Now focus on the posterior aspect. You will see 5A and 5B. 5A would be denoting or would be responsible for the lateral jugular lymph nodes, and 5B will be called as supraclavicular lymph nodes, especially if in that area on the left side the supraclavicular lymph nodes are enlarged. You must suspect carcinoma of the stomach. So all these levels are very important. While you are doing ultrasonography, you should have to have a sufficient knowledge and anatomical orientation of all these lymph nodes, and while you are reporting, always mention that which lymph node is enlarged and how much enlargement is visualized, and try to make a follow-up note so that you can scan these patients after an interval for the regression. Keep in mind that there are more than 300 lymph nodes in the neck region. So far the normal lymph nodes appearances are concerned, it should be oval in shape. It should have an echogenic hilum, and this hyla shows normal vascularity on the Doppler imaging. So far its homogeneity is concerned, its cortex should be homogeneous, it should be having a well-defined margin, and its longer axis should be longer and its shorter axis should be shorter. Like if in case anterior posterior diameter should be decreased as compared to its transverse diameter. If anterior posterior or short axis is more than 1 centimeter, this will be considered as pathological. So always pay attention to the measurement of its long axis and short axis. So this is how you will appreciate the normal lymph node on the ultrasound imaging. In this image you can appreciate well-defined oval shaped normal lymph node. Its cortical margins are regular, there is no irregularity, its homogeneity is normal, its hilum is echogenic, and if you put the Doppler signal on this lymph node you will find vascularity within the hilum. Now the question is how we will appreciate the abnormal lymph node appearance on the ultrasonography. So mind you that the first thing that would be, it will appear round in shape, and in many cases if it is irregular, so you must suspect something very pathological. Its parenchyma will appear heterogeneous, and if you put the Doppler signal on it, it will show increased vascularity. Its short axis will be increased, anterior posterior diameter will be increased, so this is another pathological sign. And in some cases you might see intranodular necrosis. Sometime you may see intranodular calcification. Beside this, also pay attention to its multiplicity, as whether this is solitary lymph node or it's multiple lymph nodes, or these lymph nodes are discrete or matted together. Mind you, in the cervical area, if there are lymph nodes matted together and rubbery in nature, it is characteristic of tuberculosis appearance. So this video shows and demonstrates you pathological enlarged lymph nodes. Look for the internal echogenicity, it's heterogeneous, there are vascularity on the Doppler imaging. Beside this, there is no longer maintenance of internal echogenic hilum. So these are, and the fourth point is, these are all multiple. So these are pathological enlarged lymph nodes. However, you cannot see any necrotic degenerative changes within the lymph node, but these lymph node appears round in shape. Another example of multiple enlarged lymph nodes, this is cervical area, and this is cervical level 2, 3, and anterior cervical chain lymph nodes are enlarged. Look to the lymph nodes. The first thing is you will find there is multiple lymph node. Second, if you see these are having a round margins, like there is a anterior posterior diameter is increased. And the second thing is you can see that their parenchyma is a bit heterogeneous. So this is what the abnormal lymph nodes will appear on the ultrasound imaging, and you have to pay attention to. Here this area which is actually groin area, and around the groin area here some in the surrounding lymph nodes are enlarged. This is what the inguinal hernia is, and secondary to hernia you will quite often see enlarged lymph node in that particular area. So here now it's quite visible to you. Here you can see these are all the enlarged lymph node because of the inguinal hernia, and this is pathological enlargement. This is another example of the reactive enlarged lymph node because of the inguinal hernia. So here you can see these are all the abnormal or enlarged lymph node, and this is reactive lymph nodes. Report writing and differential diagnosis is really an art. You have to be very smart while you are writing your report, and all these information which you will appreciate on the ultrasound screen, it should be pinned down and it should be on your report. Like you should have to mention and you should have to explain its echogenicity, its hilar echogenicity, its cortical echogenicity, its outline, its abnormal or irregular shape, its multiplicity, all should be in your on your report. So far the differentials are concerned, you should have to have the proper history of the patient, and according to the history you can label the patient for the different diagnosis for the different diseases. Always look for whether this is a reactive lymphadenopathy. Sometime it might be tuberculotic, sometime it would be infective, and sometime there will be a lymphomatous or lymphoma changes. Look for whether this is primary nodular enlargement or this is due to secondary metastatic deposits. So these few points you should always consider, and take the history from the patients, and keeping the patient history, previous diagnosis and ultrasound appearance in view, you can shape your differential diagnosis.